If you're over 60 and taking medication for high blood pressure, this video could be one of the most important ones you watch this year. Because while blood pressure pills save lives every single day, cardiologists are now warning that some commonly prescribed medications may carry hidden risks, specifically for older adults' risks that don't always show up right away. We're talking about side effects like sudden dizziness, dangerous drops in blood pressure when standing, increased fall risk, confusion, and even complications that can quietly reduce independence over time. And here's the part most people don't realize. These risks aren't about doing something wrong. They're about how the aging body processes medication differently. Harvard Medical School, Mayo Clinic, and other major medical institutions have published research showing that certain blood pressure drugs require extra caution after 60, especially when doses, combinations, or long-term use aren't regularly reviewed. Today, we'll walk you through 6 blood pressure medications that doctors closely monitor in older adults, not to scare you, but to help you have smarter conversations with your physician. And before we begin, comment below with your age and the city or country you're watching from. We love seeing where our wise, experienced viewers are tuning in from. Now, let's get started. Number 6, alpha and combined alpha-beta blockers. Number 6 on our list includes alpha blockers and combined alpha-beta blockers, medications such as labetalol that are sometimes prescribed to help control high blood pressure in older adults. At first glance, these drugs seem like a smart solution. They work by relaxing blood vessels, allowing blood to flow more easily, and reducing pressure. But here's what many patients are never told. This same mechanism can create serious risks as we age. Cardiologists and geriatric specialists have long warned that alpha and alpha-beta blockers are strongly linked to a condition called orthostatic hypotension. That's a sudden drop in blood pressure when you stand up. And if you've ever stood up and felt dizzy, lightheaded, or unsteady, pay close attention to this. As we get older, the body's ability to quickly regulate blood pressure slows down. Harvard Health Publishing explains that blood vessels don't tighten as fast, and heart rate adjustments become less responsive. When a medication further relaxes blood vessels, the result can be a sudden loss of balance before the body has time to react. This is where the danger begins. Even a brief moment of dizziness can lead to a fall. And falls are not minor events for older adults. They are one of the leading causes of serious injury, hospitalization, and loss of independence after age 65. Here's the part that surprises many people. Because of this risk, alpha blockers are rarely used as first-line blood pressure medications in older adults today, unless there's a very specific medical reason. When doctors do prescribe them, they usually start with the lowest possible dose and monitor symptoms closely, especially during the first few weeks. But there's more you need to know. These medications can be especially risky at certain times of day. Standing up quickly in the morning, getting out of bed at night, or rising from a chair after sitting for a long time can all trigger sudden drops in blood pressure. That's why many clinicians advise older adults on these medications to stand slowly, pause before walking, and report any dizziness immediately. And this is critical. Do not stop these medications on your own. The issue is not that they are dangerous for everyone. The issue is that they require careful supervision, especially in seniors. In the next section, we'll talk about a blood pressure medication that millions of older adults take every day, and why doctors now pay much closer attention to it than they used to. Stay with us, because the next one is far more common than you might think. Number 5, diuretics, often called water pills. Number 5 on our list includes diuretics, commonly known as water pills, such as hydrochlorothiazide, and related medications that are widely prescribed to treat high blood pressure, especially in older adults. Diuretics work by increasing the amount of sodium and water the kidneys remove from the body. This lowers the volume of fluid in the bloodstream, which reduces blood pressure and decreases strain on the heart. Because of their effectiveness and low cost, diuretics are often recommended as a first-line treatment for hypertension. However, medical research shows that older adults respond differently to fluid and electrolyte changes than younger adults, and this is where careful monitoring becomes essential. According to Harvard Health Publishing and the Mayo Clinic, aging affects kidney function, thirst perception, and the body's ability to maintain fluid balance. As a result, seniors taking diuretics are more susceptible to dehydration, even when taking the medication exactly as prescribed. This matters because dehydration in older adults is associated with symptoms such as fatigue, dizziness, weakness, dry mouth, and confusion. These symptoms can develop gradually and may not be immediately recognized as medication-related. But hydration is only one part of the picture. Diuretics can also alter electrolyte levels, particularly potassium and sodium. Potassium plays a critical role in muscle contraction and heart rhythm, while sodium is essential for nerve signaling and balance. Medical literature shows that low potassium levels, known as hypokalemia, can cause muscle weakness, cramps, and abnormal heart rhythms. Low sodium levels, or hyponatremia, are associated with confusion, impaired balance, and increased fall risk in older adults. Here's where blood pressure control and safety intersect. Studies referenced by Harvard Health indicate that diuretics are associated with orthostatic hypotension, a condition in which blood pressure drops when standing up from a seated or lying position. This occurs because reduced blood volume makes it harder for the body to quickly adjust blood pressure when changing posture. In older adults, orthostatic hypotension is a well-established risk factor for falls. Even brief dizziness upon standing can increase the likelihood of losing balance. Another evidence-based consideration is timing. Because diuretics increase urine production, they often lead to more frequent nighttime urination. Mayo Clinic notes that nighttime bathroom trips increase fall risk, especially when lighting is poor and blood pressure is naturally lower during sleep. For these reasons, clinical guidelines emphasize regular monitoring for older adults taking diuretics. This includes periodic blood tests to check electrolyte levels, blood pressure measurements in both seated and standing positions, and routine medication reviews to assess whether the dose and combination remain appropriate. The key scientific takeaway is this: diuretics are effective and often beneficial, but in older adults, they require individualized dosing and ongoing evaluation. Symptoms such as dizziness, weakness, confusion, or balance changes should always be discussed with a healthcare provider rather than assumed to be part of normal aging. And before we move on to number 4, a quick reminder. If this video has been helpful so far, please like the video, subscribe to the channel, and turn on notifications. We focus on evidence-based health information designed specifically for older adults. Now, stay with us, because number 4 involves a medication class that millions of seniors take every day, and the science behind it may surprise you. Number 4, calcium channel blockers. Number 4 on our list includes calcium channel blockers, a widely prescribed class of blood pressure medications that includes drugs such as amlodipine and diltiazem. These medications work by blocking calcium from entering the muscle cells of the heart and blood vessels. When less calcium enters these cells, blood vessels relax and widen, allowing blood to flow more easily. This lowers blood pressure and reduces the workload on the heart. Because of this mechanism, calcium channel blockers are considered effective and are commonly used in older adults. But here's what research shows is important to understand. As the body ages, the cardiovascular system becomes less adaptable. Blood vessels stiffen, reflexes that regulate blood pressure slow down, and the nervous system takes longer to respond to changes in posture. According to discussions from Harvard Health Publishing and Mayo Clinic, medications that relax blood vessels can sometimes amplify these age-related changes, particularly in older adults. One of the most documented concerns is orthostatic hypotension, a drop in blood pressure when standing up. Calcium channel blockers can contribute to this effect by preventing blood vessels from tightening quickly when a person moves from sitting or lying down to standing. This may sound minor, but it has real consequences. Older adults who experience lightheadedness, dizziness, or unsteadiness after standing are at a higher risk of falls. Clinical studies consistently show that falls are a major cause of injury, hospitalization, and reduced independence in people over 65. And there's more. Certain calcium channel blockers, particularly those that act on the heart as well as blood vessels, can cause slower heart rate, fatigue, and reduced exercise tolerance in some older adults. These effects may not be dangerous on their own, but they can contribute to overall weakness and reduced stability. Another well-documented side effect is leg and ankle swelling, especially with medications like amlodipine. Mayo Clinic explains that this swelling occurs because relaxed blood vessels allow fluid to leak into surrounding tissues. While often considered a nuisance side effect, swelling can make walking uncomfortable, alter gait, and increase fall risk over time. Here's what surprises many people. These side effects often develop gradually. A person may not notice a clear start date for symptoms like fatigue, swelling, or mild dizziness. As a result, they may assume these changes are simply part of aging, rather than possible medication effects that deserve attention. Medical guidelines emphasize that calcium channel blockers are generally safe, but dose matters, especially in older adults. Lower starting doses and gradual adjustments are commonly recommended. Doctors may also periodically reassess whether the benefits continue to outweigh the side effects as health status changes. Another key factor is medication combinations. When calcium channel blockers are taken alongside other blood pressure medications, the risk of low blood pressure and dizziness can increase. This is why regular medication reviews are strongly recommended for seniors. The most important takeaway is balance. Calcium channel blockers are effective and beneficial for many older adults. The goal is not avoidance, but individualized treatment and ongoing monitoring. Any new symptoms, such as swelling, dizziness, fatigue, or balance issues, should be discussed with a healthcare provider. And stay with us. Because number 3 targets a medication class that many seniors don't even realize can affect balance and cognition, even when blood pressure numbers look perfect. Number 3, beta blockers. Number 3 on our list includes beta blockers, a class of blood pressure medications such as metoprolol, atenolol, and propranolol that have been prescribed for decades. Beta blockers are commonly used to treat high blood pressure, heart rhythm problems, and a history of heart attack. These medications work by blocking the effects of adrenaline on the heart and blood vessels. This slows the heart rate, reduces the force of heart contractions, and lowers blood pressure. In many situations, especially after heart disease, beta blockers provide clear and proven benefits. However, medical research shows that their role in older adults requires careful consideration. As we age, the nervous system becomes less responsive, heart rate variability decreases, and the body's ability to adjust quickly to physical demands weakens. According to Harvard Health Publishing and Mayo Clinic, beta blockers can sometimes magnify these age-related changes, particularly in seniors. One well-documented effect is excessive slowing of the heart rate, known as bradycardia. In older adults, this can lead to fatigue, weakness, reduced exercise tolerance, and lightheadedness. These symptoms may appear gradually and are often mistaken for normal aging. Here's why that matters. When heart rate response is blunted, the body may struggle to increase blood flow quickly during activities like standing up, walking, or climbing stairs. This can contribute to dizziness and unsteadiness, especially when combined with other blood pressure medications. Another scientifically recognized concern is orthostatic hypotension. While beta blockers do not directly relax blood vessels like some other medications, they can interfere with the heart's ability to compensate when blood pressure drops. Studies cited by Harvard Health indicate that this can increase fall risk in older adults, particularly when standing quickly. There's also an important cognitive aspect. Some beta blockers, especially those that cross the blood-brain barrier, have been associated with fatigue, sleep disturbances, and reduced mental sharpness in certain individuals. Mayo Clinic notes that older adults may be more sensitive to these effects due to changes in brain chemistry and drug metabolism. Another key point often overlooked is effectiveness with age. Large reviews of clinical data have shown that for uncomplicated high blood pressure, beta blockers may be less effective at preventing stroke in adults over 60 compared to other medication classes. Because of this, many modern guidelines no longer recommend beta blockers as a first-line treatment for hypertension alone in older adults, unless there is another clear indication such as heart disease or arrhythmia. This does not mean beta blockers are unsafe or unnecessary. For many people, they are essential and life-saving. The issue is appropriate use and regular reassessment. Dose matters significantly. Older adults often require lower doses due to slower drug clearance and increased sensitivity. Combining beta blockers with other blood pressure medications can further increase the risk of fatigue, dizziness, and balance problems. The most important scientific takeaway is awareness. If an older adult taking a beta blocker experiences increasing fatigue, dizziness, reduced stamina, or balance changes, these symptoms should be discussed with a healthcare provider. Medication adjustments, dose changes, or alternative therapies may be considered based on individual health needs. And stay with us, because number 2 involves a medication class that is widely considered safe, yet research shows it still requires special caution in older adults, especially when combined with other treatments. Number 2, ACE inhibitors. Number 2 on our list includes ACE inhibitors, a widely prescribed class of blood pressure medications, such as lisinopril, enalapril, and ramipril. These medications are commonly used to treat high blood pressure, heart failure, and to protect kidney function, especially in people with diabetes. ACE inhibitors work by blocking an enzyme that produces angiotensin II, a substance that causes blood vessels to tighten. When this enzyme is blocked, blood vessels relax and widen, allowing blood to flow more easily and lowering blood pressure. For many patients, this mechanism provides clear cardiovascular benefits. However, research from institutions such as Harvard Health Publishing and Mayo Clinic shows that older adults may experience specific risks that require closer monitoring. One of the most well-documented concerns is excessive blood pressure lowering, particularly when starting an ACE inhibitor or increasing the dose. As people age, the body's ability to regulate blood pressure becomes less efficient. Blood vessels respond more slowly, and the nervous system takes longer to compensate for changes in posture. This is where problems can arise. ACE inhibitors can contribute to orthostatic hypotension, a sudden drop in blood pressure when standing up. Older adults may experience dizziness, lightheadedness, or unsteadiness when rising from a chair or bed. Even brief episodes of dizziness can significantly increase fall risk, which is a major cause of injury in people over 65. But that's not the only issue clinicians watch closely. ACE inhibitors can affect kidney function, especially in older adults who may already have age-related declines in kidney performance. Mayo Clinic notes that while these medications often protect the kidneys in the long term, they can cause short-term changes in kidney blood flow. This is why doctors routinely monitor kidney function and potassium levels after starting or adjusting an ACE inhibitor, and potassium is a key part of this discussion. ACE inhibitors can cause potassium levels to rise, a condition known as hyperkalemia. Elevated potassium can interfere with normal heart rhythm and muscle function. Older adults, particularly those with kidney disease or those taking potassium supplements or certain diuretics, are at higher risk. Here's something many people don't realize. The well-known persistent dry cough associated with ACE inhibitors may seem harmless, but in older adults, it can interfere with sleep, increase fatigue, and even raise fall risk when coughing episodes occur at night or when standing. Another rare but serious side effect is angioedema, a sudden swelling of the lips, tongue, or throat. While uncommon, studies show the risk is slightly higher in older adults and requires immediate medical attention. Despite these concerns, ACE inhibitors remain an important and effective treatment for many people. The scientific consensus is not that they should be avoided, but that they must be carefully individualized in older adults. Clinical guidelines emphasize starting with lower doses, monitoring blood pressure, both sitting and standing, checking kidney function and potassium levels regularly, and reassessing treatment as health conditions change. The most important takeaway is communication. Older adults taking ACE inhibitors should report symptoms such as dizziness, faintness, swelling, unusual fatigue, or persistent cough to their healthcare provider. These are not simply signs of aging, but signals that medication effects may need adjustment. And stay with us, because number 1 is the medication issue that cardiologists talk about the most in older adults, and it often surprises people because of how common it is. Number 1, angiotensin receptor blockers, also known as ARBs. Number 1 on our list includes angiotensin receptor blockers, commonly called ARBs, such as losartan, valsartan, and candesartan. These medications are among the most frequently prescribed blood pressure drugs for older adults and are often viewed as a safer alternative to ACE inhibitors. ARBs work by blocking the action of angiotensin II, a hormone that causes blood vessels to narrow. When this hormone is blocked, blood vessels stay relaxed, blood pressure lowers, and the heart doesn't have to work as hard. Because ARBs do not typically cause the persistent cough seen with ACE inhibitors, they are widely considered well tolerated, and in many cases they are. But here's what research from institutions like Harvard Health Publishing and Mayo Clinic makes clear. Well tolerated does not mean risk-free, especially in older adults. One of the primary concerns with ARBs is low blood pressure, particularly when standing. As the body ages, the reflexes that regulate blood pressure become slower and less effective. When an ARB relaxes blood vessels, the body may struggle to maintain stable pressure during position changes. This can lead to dizziness, lightheadedness, or feeling unsteady when standing up. Even mild symptoms matter because in older adults, balance disturbances significantly increase fall risk. And falls are not minor events. Medical research consistently shows that falls are a leading cause of injury, hospitalization, and long-term loss of independence in people over 65. A brief drop in blood pressure when standing up from a chair or bed can be enough to cause a serious accident. There's another important factor doctors monitor closely. ARBs can affect kidney function, particularly in older adults who already have reduced kidney reserve due to aging. Mayo Clinic explains that while ARBs often protect kidney health over time, they can cause short-term changes in kidney filtration, especially when dehydration, illness, or other medications are involved. This is why kidney function tests are routinely checked after starting an ARB or adjusting the dose. Potassium levels are also part of the equation. ARBs can increase potassium in the blood, a condition known as hyperkalemia. Elevated potassium can interfere with normal heart rhythm and muscle function. Older adults are at higher risk, especially if they have kidney disease or are taking potassium supplements or certain diuretics. Here's something many people don't realize. ARBs are often prescribed in combination medications, meaning they are paired with diuretics or other blood pressure drugs in a single pill. While this can improve convenience, it can also increase the risk of low blood pressure, dehydration, and electrolyte imbalance if not carefully monitored. Because ARBs are so commonly prescribed, symptoms like dizziness, fatigue, or weakness are sometimes overlooked or attributed to aging rather than medication effects. Clinical guidelines emphasize the importance of regular blood pressure checks, including measurements taken while standing, not just sitting. The scientific consensus is clear. ARBs are effective and often beneficial for older adults, but they require individualized dosing, regular monitoring, and periodic reassessment, especially as health status changes over time. The most important takeaway is not alarm, but awareness. If an older adult taking an ARB experiences dizziness, balance issues, weakness, or changes in kidney function, these symptoms should be discussed with a healthcare provider. Adjustments can often be made to improve safety while maintaining blood pressure control. And that brings us to an important conclusion. Blood pressure medications save lives, but in older adults, the right medication, the right dose, and the right monitoring matter more than ever. As we've discussed today, blood pressure medications play an important role in protecting heart health. But as the body changes with age, the way these medications affect older adults can change as well. Understanding potential side effects helps you ask better questions and stay actively involved in your care. If you found this video helpful, please like the video, subscribe to the channel, and turn on notifications so you don't miss future videos focused on evidence-based health information for older adults. And now, we'd love to hear from you. Which of the medications we discussed today